Hormone optimization expert Angie Nichols discusses the best contraceptive methods or birth control options. And if this is your first time here, make sure to subscribe so you can learn more about fitness and nutrition, hormones and anti-aging, all this to optimize your life overall. And hit that notification bell so you don't miss anything. So Angie, let's talk about contraceptives. Maybe start with the birth control pill. What's your opinion on that? Is it actually healthy? Because I know there are a lot of different kinds. I can't even follow up with all the new kinds that are coming on our market. So which one is safe to use? Which one should we choose? How long to take it? And are there benefits to it?
Well, there's a lot to consider when a woman is looking at different methods of contraception and what may work best for her. Personally, I would never want to take an oral contraceptive because it is going to be made from synthetic hormones. It's going to be a synthetic estrogen and or there are some that have progestin only, but we know that progestins are linked to cancer. There's just an overwhelming amount of literature out there that shows harm with synthetic hormones, especially in women. So they can increase your risk of blood clot. That risk is increased further if they're smokers or if they're overweight. And so they're not healthy. But, women have to do something to prevent, an unwanted pregnancy. So you have to really look at what's going to be best in each individual situation. They have their own side effects that you have to be aware of, but there's not one that I would say is healthy. And if I could avoid them, I would certainly do everything in my power to avoid them.
Okay, that's in your opinion certainly not a first choice of a contraceptive, the pill.
Any type of hormone contraception is going to carry risk. And, we have the risk of breast cancer. We have the risk of increased, especially invasive cervical cancer. Studies out there show that it can increase your risk of liver cancer, can also increase your risk of DVTs or blood clots, heart attack, stroke. It can cause mood changes. There's some studies that I have been looking at recently showing there are so many women that are on oral contraceptions, and they've been around since the 50s. So they've been used for a long, long period of time in a lot of women, but we're just now learning the negative effects that it even has on the next generation. So a woman that took them in the 50s, 60s, 70s, it's shown that it's having some negative effects even in, the adult children of today. So we don't really fully understand everything that these synthetic hormones can cause, but I would try to avoid it at all costs. But anyway, in these studies that I was talking about, they asked women and evaluated their subjective opinion of their quality of life on birth control pills and off. And the majority of women say that it's overall, and the assessments that they have done, is that they have a poorer quality of life while on birth control pills. A large majority of them cause weight gain. It can cause menstrual irregularities, bloating, headaches, and decrease in sex drive because they will lower testosterone levels. When you take birth control pills, that lowers your testosterone. So anytime we lower testosterone, it's going to make it more difficult for us to lose weight. It increases our insulin resistance and will lower sex drive. So it's not the ideal contraception, in my opinion. But all of them carry risk. Every form of contraception, other than abstinence, they all have risk. So every woman has to decide for herself what's going to be best when looking at contraceptives.
Okay, that will be difficult, of course, because most people just listen to their family doctor because they trust him and he's not very knowledgeable about hormones. Most of them aren't. I see a lot of girls, 14 to 16 years old, already getting these oral contraceptives just because of pain every month or because of acne. They say they come to me for acne. They say, "Oh, it's already much better since my family doctor gave me the oral contraceptive." So yeah, that's difficult to resist, I guess.
Absolutely. And it will make the acne better because it's lowering their testosterone, but it's also causing other problems that, you have to look at. And, some things can be improved, like with the PMS and the menstrual cramps. And, that's a real problem. There are girls that, for 1 or 2 weeks out of the month, they are very uncomfortable and they don't feel like doing anything. But those can also be treated effectively using progesterone, bioidentical micronized progesterone. There's different ways that you can get that, but I would look at a way like that to manage some of those PMS type symptoms as opposed to looking at a synthetic progestin. And you say about the family doctors for the most part are trained by pharmaceutical companies. That's where the information comes from. When they're in medical school, the medical schools fund pharmaceutical companies fund medical school. So they're going to influence very heavily what gets taught in the curriculum. And, they're going to encourage prescriptions. So patients have to be their own best advocate.
And what is a better contraceptive? What about the intrauterine devices, hormonal or non-hormonal?
Well, that's an option. That's another option that's out there. They carry their own possible side effects. I would stay away from anything hormonal because, again, it's going to be just a synthetic hormone. It's going to have the same kind of negative side effects that oral contraceptives have. But there are some non-hormonal IUDs out there. There's one with the trade name Paragard here in the United States. But, again, they can cause problems too because it is an invasive. It's, a family doctor has to insert it and would have to remove it. It's coated with copper and placed, inside the body. But that would be a better choice for me, in my personal opinion, than a pill because it's non-hormonal.
Mm-hmm. Any other options?
Well, there are different options that you can look at. I mean, the pill, the patch, there are patches, but again, that's going to be hormonal. They do implants where they put them inside the arm and it releases, but again, that's hormonal too. There's IUD, there's diaphragm, there's a female condom, there's cervical caps, but you have to be fitted for those too, and that's not necessarily the most convenient thing. And women typically don't have to like a pill's an easy thing. You just take it and go on about your business. But if you look at the long-term consequences, I would very seriously, urge women to do a little research on their own and make a well-informed decision before they just decide that they're going to take something.
Okay, and what is it that you recommend young 16-year-old girls that want to start with an with a contraceptive?
Well, in our practice, Dr. Nichols does not prescribe contraceptives, of course, because we're just focusing on age-related hormone decline. But I have a teenage daughter, and, for her, I would never want her to take a hormonal contraceptive. Then again, you have to be practical also and understand that, you have to do something to protect against unwanted pregnancy because, that can bring on its whole lot of other problems. And poverty rates in young girls that get pregnant and not on purpose are very high. So, but personally, now for a 16-year-old that's just having premenstrual cramps and things like that, progesterone would be my choice for sure. But I would want them to look at something that was a non-hormonal way if you can get them to be compliant. So you have to just weigh the benefit, risk, and take it case by case.
And that's just using a condom in first sexual relationships then?
Well, I guess, or there's female condoms, there's IUDs, there's, all these spermicidal, sponge, and things like that.
So I guess the most practical thing is a non-hormonal intrauterine device.
That would be my choice. But then again, in a young person, that's tricky because, I'm not sure if there's an age or that they would put those in. I don't know because that's not what we do really. But that would be, in my opinion, the safest.
Okay. I know there's gynecologists that won't like to insert intrauterine devices before a first birth.
Okay. Yeah.
But-
It's a tough question because, obviously there needs to be something, but I just know what the literature says about the long term risk that taking hormonal contraceptives cause. And so that would be a big concern of mine.
Mhm. So I will have two teenage daughters in 5 years. So what do I recommend them?
That at the door, probably. Yeah, I, I don't know. That's something very, very, very much individualized that I would have them talk to with the mom and their doctor, and where you go from there. I don't know.
Okay, very difficult question, I see.
It's a
Yeah.
difficult question. It is.
Yes, but I do that with patients always. I always say to my patients as well when I recommend them whatever medication for whatever skin disease they have, because a lot of patients look at me and they say, "Is that safe? Would you take that?" And I always say, I only recommend what I would recommend to my wife, to my children, because I want you to be safe as well. I'm a doctor. I'm here for your best health interest. So I'm already thinking out loud for my daughters in here and 5 years probably. So
Right.
okay, still a few years to think about that. To have some research to do.